Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hi everyone, welcome to episode 16 of the Canine Culture Podcast. This is Brittany, and we have a special guest today. Her name is Sommer, and she runs Movin Tails Canine Rehabilitation and Wellness. So welcome to the show.
Hi, Brittany. Thank you so much for having me. I'm so happy to be here. This is such a wonderful opportunity to talk about canine rehab.
So tell us a little bit about yourself and the company that you have.
Yeah. So my background is in human physical therapy, and back in 2018, I had gotten certified in canine rehab. And then I started in the latter half of 2019, I started Movin Tails, which is a mobile canine rehab practice here in Jacksonville, Florida. So I go to people's homes and treat their dogs. And I treat dogs of all ages, but I do specialize in the senior dogs. I think it's a population that is very underserved, and oftentimes owners are told the dog is just getting old, it's just old age, you're just going to have to live with that. And there's so many things that we can do for these dogs to help give them a better life, get them moving better, and get them stronger.
So I know your focus is rehabilitation and wellness, and the main component of that is physical therapy. So what exactly is physical therapy for dogs?
Yeah, so just like there's physical therapy for people, obviously there's a lot of carryover, which is nice having my background in human physical therapy, because there is so much carryover with that. So, physical therapy for dogs, we help restore function and helping getting them stronger. We're treating kind of anything a human would be having physical therapy for, whether there's an injury, a disease, following a surgery. If there's functional impairments, those are things that we want to help maximize their function and independence. So with the dogs, they're getting back to help get them back to their daily routine and activities to help improve the pet's quality of life. So with that being said, with our physical therapy, when I go to someone's home, we're always making sure beforehand, we get like the pet's medical records, do a thorough review of that with the owner. If any diagnostics were performed with the pet as well, that we're reviewing all that beforehand. We do a pretty comprehensive evaluation. And what that looks like when we do get to their home, we start looking at like the pet's posture, because that can tell a lot too, just a postural scan, what might be going on there. Then we start looking, gait analysis, how the dog is walking. We pick up a lot of information from that. We look at what we call transitional movements, how a dog moves from one position to another. Are there any compensations, things that they look like they might be struggling with? We assess their strength. We look at the range of motion of their joints, flexibility of their muscles. We like to too, as we're getting more into the hands-on components, feeling their muscle tone. Are there certain areas or certain muscle groups that are feeling tight and guarded that can provide us a lot of information as well? I'm really big on owner education. So as I'm going throughout the evaluation, I'm explaining my findings, pointing things out, and having owners feel things as well as we're going along, so they're part of the process. That's important. People want to know what you're doing to their dog and what you're finding. And I think that's super important, so they have the knowledge of what's going on, but then what are we going to do about it? So also as part of our evaluation process too, because I do in-home rehab, I think another important component of that is a home assessment. So we want to make sure if the pet is having, mobility issues or weakness, whatever it might be, we want to see, how the pet has to navigate around their home. Are there certain modifications that need to be made? A lot of that too. I'm always looking at what type of flooring people have. If you have tile or hardwood, and you notice the dog is slipping more, we want to make sure we're providing recommendations or suggestions to owners for that. So that's always something too, with home modifications and the home assessment throughout the evaluation. And then what we do as part of the evaluation, we do provide a first full treatment session. So again, based on our findings with the evaluation, we like to, keep things as simple as possible because sometimes it can be a little overwhelming, for the pet and owner. But we want to make sure, based off of our findings, what are the most pertinent things we need to address at that visit. So oftentimes, that's starting with some basic strengthening exercises that would be appropriate for the pet at that point. Any manual therapies. What I mean by that, any massage work, stretching, range of motion. If we feel it's appropriate and the pet would benefit from it, we do laser therapy as well. So all of these things, we're obviously demonstrating to the owner how to do these things, but also we have the owner do these things as well. So we know that they understand, they know how to do this, because the other component of this, in addition to us just coming to the house, each owner is given a customized home exercise program that's specific for their pet. So we believe it's not a one size fits all approach. Each dog is going to present differently, is going to have different issues. So each owner, we give them a customized home exercise program that they can work on with their pet in between our visits, because we want that carryover effect. So the pet continues to improve, get stronger over the course of our time working together. Then at the end of our first visit, that's when we sit down and discuss with the owner what our recommendations are for a plan of care. How many sessions we think would be appropriate, how often we should meet. So then they know what to expect throughout the process.
So I wish this was video recorded, because Stoney came over and started giving dirty looks whenever we started to talk about physical therapy and all of the homework, because she has to do PT every day. But then she got kind of perked up on the massage part, because that's her favorite thing. So Stoney, for anyone that doesn't know, is 13 years old, and she benefits greatly from physical therapy. A couple of vets have told us that without it, she probably would not be able to walk. Honestly, I don't know what her quality of life would be without it. So, kind of leading into that, what is the importance of physical therapy? And you kind of touched on it, but just so people really get the value add of what physical therapy can do, what do you think is the most important part of dogs getting physical therapy?
There's a lot, but what I feel, what I had alluded to before, I honestly feel the most important part is whatever we work on, we're working on things to improve the pet's quality of life. Like I said, whether it is mobility issues or weaknesses, or balance issues as well, or a combination of thereof, we're always going to find things that we can work on to help with that. So then we can help the pet get back to their routine, their activities. And maybe it is slightly modified from what things were before. But I always feel no matter what, if we can get them moving just a little bit better, get them a little bit stronger, even back to things that maybe they haven't been doing for a while, that's so much better. And we're really just trying to give them the best quality of life possible.
So what dogs do you think need physical therapy? Or, if an owner has a dog and they've had a recent injury or a change in activity, when do you normally recommend that a dog receive physical therapy?
Okay.
Or what type of ailments, I guess?
Gotcha. So my short answer to the question, what dogs would benefit from therapy, my short answer is pretty much almost any dog would benefit, really. We always make sure that for us that the pet is evaluated by their veterinarian beforehand. We want to make sure there's no other underlying issues going on. We just that it's safe for the pet to participate in therapy. But once we get the green light and everything's good, really any pet. However, same as for people, in terms of injuries, whether there's an orthopedic injury, neurologic, anything related to like the brain and spinal cord, following any type of surgery, again, whether that's orthopedic, neurologic, or something outside of that as well. Is there a senior population or just dogs in general who are having those mobility or weakness issues as well? Of course, they greatly benefit from that. A dog that may have had an amputation, well, certainly that changes things greatly, and they are definitely going to benefit from that. And also, we can't forget about our athlete population. They do get injuries, but they also, they get conditioning too. So there's therapists out there that specialize in that with the conditioning for our athlete population.
So whenever a dog does start PT, and I know this is going to be custom for every dog, but how often should they be seeing you? Yeah. And then normally, how often are they doing their homework at home?
Great question. So typically with us, and this, like you had said, this might vary from practice to practice. For us, when we first start seeing a dog, ideally, I like to have our sessions on a weekly basis up front, as we're building upon our strength and really trying to get things going. I do think it's important that we're meeting weekly and kind of laying the foundations and gradually building up to things. As the pet is getting stronger, we will start spreading those visits out. So then it could, every 2 weeks, every 3 weeks, and progressing to monthly. Most of the time, with the cases that we see, typically we're seeing them once a week. And if there are special cases that the pet might, benefit from 2 times a week, or that's something that the owner really wants, of course we'll do that. Most of the time it's once a week, again, with the expectation that the owner is being very diligent and compliant with working on that home exercise program. Honestly, without it, it's not to say that the pet isn't going to get better or benefit from it. We just see a lot greater return. The pet is going to get better faster, get back to the things they're doing. So really, the dedication and compliance from the owner makes a huge difference.
Yeah, it's kind of like people. I mean,
yeah,
if you go to physical therapy,
yeah.
If you don't do your homework when you get home, then it's not a complete waste, but you're getting 10% rather than 90. You know what I mean?
Yeah. So that's something, I talk with people all the time, whether it be on the phone or in person. I always say, I like to set the expectation that if we're going to do this, that commitment and dedication needs to be there. If you want the best outcome for your dog, you need to work on this. And I said this to my human patients before, when I was still in the human practice. I always say, and I truly believe this, what you get out of something is what you put into it.
Yeah, absolutely. So are there any common breeds that you see as a recurring patient?
I have not, which, not saying that there can't be. Since I've had my practice, I've seen a wide variety of breeds, which is always nice getting to know different breeds for a lot of different conditions. But there are breeds out there that can be susceptible to certain conditions as well. We know our smaller toy breeds, they can be a little bit more susceptible to problems with like the knee dislocating. Sometimes they think that might be a genetic predisposition. So that can be a little bit more common in our smaller breeds. Our dogs with like the long backs and short legs, they're more susceptible to back issues such as, intervertebral disc disease. That can be more common, but certainly that can happen in any dog. With cruciate injuries is definitely a very common thing we see quite a bit of. Really, that any dog it can happen in, but there are certain breeds that have a little bit higher risk for that.
And we talked a little bit about senior dogs, and I know that's kind of like your specialty. Mm-hmm. That's kind of where my heart's at too. What are some things that dog owners can do at home for their senior pups to make sure they're still moving as optimally as possible?
Yeah. So, so this one of my favorite questions. So, there are quite a few things. Obviously, this, every pet is different as they age, but one of the first things that I really recommend, if at all possible, if you haven't already, developing a walking routine. Some owners have a walking routine with their dog already. Some don't, or they just kind of walk around or play in the backyard, which is fine as well. But I always think like that's really important with getting them some type of walking routine. And as our pups get older, we always feel like they benefit more from shorter, more frequent walk. So instead of doing a 25 or 30-minute walk, breaking that up into 2 15-minute walks a day. And at any point during your walk, if you're noticing your dog's getting tired, stop and offer them a rest break. Don't force them to get back home. Make sure that they're getting the rest break. I also feel it's important too, just because they're getting older, if there's still certain activities that they enjoy doing, even if it might be a little harder for them, still incorporating those activities into their routine or elements of that. So we may need to modify things and change how they're done. Certain things may not be to the intensity or the level of what they were doing it at before, but if we can, modify things, I think that's important, not only physically for them, but mentally too. Keeping our pups mentally stimulated is super important at any age, but especially as they get older. That's really important. Which leads into another one of my recommendations I think is really important. Just as with people, as we get older, sometimes our mental sharpness isn't always there, and the same thing happens with our dogs. So canine enrichment is a huge thing, and I really talk about this a lot with owners of our senior dogs, but also, if a pet of any age is recovering from an injury or a surgery, well, naturally there's going to be some activity restrictions. So we really speak with owners about different types of enrichment that we can do. There's so much out there, but some of the ones that I'll recommend to owners, there's all sorts of like the puzzle toys that they can do, the snuffle mats, which a lot of dogs love that. There's the licky mats too. Those are some forms of like what we call the cognitive enrichment, but even other forms of enrichment, whether you're out, walking your dog and you see, other dogs and people walking, allowing them to say hello and sniff, and that it's still a form of mental stimulation. So the dog is still getting that interaction. I think that's really important, and not just taking everything away from them because they're older. Some other things that I think are important too, something that I talk about with my clients too, are joint supplements. There's so many out there, of course, but I always tell owners, if your dog isn't that something worth having a conversation with your veterinarian about, what they feel would be best for your pet, because there are so many out there. But especially, so we want to provide that optimal joint health and support, and especially if arthritis is present, which, more often than not, a lot of dogs get that as they get older, just like we do. So there's definitely benefit to that. So that's always things that I like to recommend to owners as well. Obviously, another big thing, which has a huge impact on a dog's mobility, is their weight. A dog at any age we want at a healthy, ideal weight. I think that's super important. But really, again, as they get older, I think that becomes even more important too. Anytime you have excess body weight, of course it's going to be harder to get around. And it puts so much undue stress on their joints, and it's just going to make them more miserable, and they're not going to want to move. So I really think that's important. Keeping your dog, at a healthy, optimal weight. kind of what ties into that is the nutrition factor. That could be an episode in itself, but just to touch on that, we want to make sure, whatever you are feeding your dog, that it's good quality food, or those who do the raw diet is fine. Just making sure the pet's still getting all the appropriate nutrients. We also want to make sure, as our dogs are getting older, their calorie intake and their amount of protein they should be receiving too, that changes too. So I always think it's important, keeping communication open with your veterinarian, as your pet's dietary needs can change as they get older, because it has a huge impact on things too. We want to make sure. Couple other things that I wanted to talk about in regards to that. One thing I talked a little bit about earlier was like home modifications. If the pet is having difficulty moving around their home, I alluded earlier with the flooring situation. So if your house has more tile or hardwood and you're noticing they're having a harder time getting around, they're slipping or even falling, I always like to advise to owner, getting either yoga mats or non-skid rugs or runners, placing them in the areas of your home that your pet uses more. And that helps immensely. It really makes a big difference, I feel. If there's issues with the pet getting on and off of the couch or the bed, even in and out of the car, which is a big one, there's different pet stairs and ramps out there that can assist with that as well. I think that's really important. And even outside, if there's like a deck or patio area that maybe they can't navigate as well, those are things to definitely consider for sure. Bedding is a huge thing. I used to not think that was important, but it is. And again, for any size dog, but especially as our pups are getting older and with our larger breeds too, and if arthritis is present, we want to make sure that they do have a nice supportive bed that supports their joints. Just as you and I, if we lay on a mattress that's not really supporting our body, supporting our joints, we're going to wake up stiff and not feeling so well. We just want to make sure with the dog beds too that it's not too soft or cushiony of a surface, because especially in our senior population, if they're already weak or have balance issues, it's going to be all the more difficult for them to move around or get on and off of the bed as well. So that's important. I wanted to also talk about, because sometimes we don't always consider these things, is proper nail care. That's huge. Sometimes we don't always think about that, or we're just like, oh, their nails are long, I need to trim them. However, that plays a big factor. Not only can it impact with how they're moving around and standing, it can have effects on their posture too, and how their weight is shifted, and they're compensating. So that's something with keeping the nails trimmed, keeping them short but not too short, and also keeping the hair, the fur between their little paw pads, keeping that trimmed as well, because that helps avoid them slipping around. It provides more traction for them. Lastly, if your pet really is having some mobility or strength issues, I always advise, of course I'm biased, but if your pet is really having mobility issues, strength issues, just finding or reaching out to a certified rehab professional in your area to assist with those things. So then we're coming up with more of a customized plan for your pet.
Yeah, I think those are all really, really good tips. The enrichment part, so we started doing puzzles. Titan will do the little snuffle mat. Stony has zero interest in puzzles,
Yeah,
but she'll lick a little mat. She'll lick a peanut butter mat sometimes. Except she kind of thinks there's medicine in there, so sometimes she skips it. We've got the doggy stairs. We're about to do ramps. And there was one more thing that you said that I was thinking about. Oh, the diet. Mm-hmm. The diet's been huge because as the dogs get older, they're less active, and it's been a little harder to maintain their weight. Mm-hmm. So like Stony has been on a quote unquote diet for a year, but she's gained 0.5 pound. So now we have to reevaluate. We've got to go lower carb, which she's not going to be excited about. We're going to up her protein a little bit. So yeah, those are all really good tips. And even for younger dogs, like you said, like the weight management part, like that's huge. You can prevent so many issues that could occur later.
Absolutely.
And just, keeping your dog comfortable just generally throughout life. So tell everyone where they can find you if they want to contact Movin Tails. Give them some information as far as your website and all of that.
Yeah. So my website is movintailsrehab.com. I'll spell that out. It's Movin, MOVIN, Tails, TAILS, rehab.com. We are on social media too. We're on Facebook and Instagram at Movin Tails Rehab. If you are local in the Jacksonville area, you can reach us at 904-834-1129. There's always email as well. And it's Sommer, SOMMER .Hall, HALL, at movintailsrehab.com.
All right, Summer. Well, thank you so much for being on the episode today.
Thank you, Brittany. I really enjoyed it. Thank you for having me.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com, or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.